In this basic approach to chest X-ray series, we'll see what are nodules on a chest X-ray and how to report them. So in this talk, we'll be seeing what are nodules, basically concentrating on chest X-ray, not the CT, how to describe them on a chest X-ray, their clinical significance if they are found on a chest X-ray, and step-by-step approach to interpreting the nodules, few case examples and tips and tricks while reporting the nodules on chest X-ray. So these are the subheadings under which I'll be discussing nodules on chest X-ray. Coming to the basics, what are nodules or what is a nodule? Nodule is nothing but a small rounded opacity less than 3 cm in size. According to Fleshner guidelines of 2024, there is another term micronodule which is less than 6 mm in size. Here you can see on this X-ray, these small rounded opacities are nothing but the nodules which are distributed in the right lung field. Next, nodule versus mass. Nodule is something which is less than 3 cm and mass is more than 3 cm. Next, in chest X-ray, we can find solitary pulmonary nodule, that is one nodule, or multiple nodules. If we go into pathophysiology, what does a nodule mean? It means that there is alveolar disease that is causing this air space opacity. That's a gross term, that is air space opacity, we call it, and specific term is nodule. Let's draw alveoli and alveolar ducts. So these are the alveoli, which are nothing but air spaces, the spaces filled with air. And surrounding alveoli, we can see there is a lining, that is the interstitium. If alveoli is filled with some abnormal material, that is anything other than air, that causes air space opacity. Materials like pus, fluid, cells or blood and even proteins can be filling the alveoli, causing these nodules to appear. What are the causes of these nodules? So there are multiple causes. It can be infectious like TB, pyogenic, fungal pneumonia. Non-infectious causes of nodules are interstitial lung disease, affecting not the air spaces but the interstitium, like non-specific interstitial pneumonia causes micronodules, rheumatoid nodules, sarcoidosis, malignancies and metastasis can cause nodules, and occupational lung disorders. In describing the nodules once found on the chest X-ray, we use ABCD approach. So A for appearance of the nodule. What is the shape? Round or irregular? What are the margins like? Are they smooth? Are they spiculated? Are they lobulated? And for B, we have borders, whether they are well-defined borders or ill-defined borders. C, look for calcification and the type of calcification or pattern of calcification, like central or eccentric or amorphous, etc. D, for distribution of nodules, you have to see whether there are single or multiple nodules and where are they located predominantly, in which zone, whether they are central or peripheral in location. That will help us to come to a differential diagnosis because each disease has different pattern of nodules. Let's look at one case using ABCD approach. You can see these nodules here. They are round nodules but with lobulated margins and very well defined margins. You can see all margins clearly. They are variable sized nodules with no obvious calcification seen on chest X-ray. That's very important. Calcification may be amorphous, may be seen on CT, but on X-ray there are no visualized calcification. Nodules are distributed in bilateral lung fields. What is the diagnosis or what is differential? For this we have to go to a more patient-centric approach. In order to come to a differential diagnosis, we have to look at patient history, whether he's a smoker, any occupational history, any history of known malignancy, known history of TB, and look at old reports if available. In radiological characterization, we have to see sequential x-rays if available. Look for growth of the nodules, increase in size or change in margins. All that I have to be look for because it shows risk of malignancy. We have to look for associated findings like hilar lymphadenopathy, which may be present in TB, malignancy, sarcoidosis along with nodules. Look for pleural effusion, can be seen in TB, pyogenic or malignancies, and look for any cavitation within the nodules, which is common in Wegener's and metastasis cases. Okay. Next we will see what are the red flags in the nodules. Rapid growth over weeks, spiculated or irregular margins, and amorphous calcification is usually seen on CT, and associated symptoms of patients like loss of weight, loss of appetite, and hemoptysis are danger signs. Now that we know how to describe nodules on chest x-ray and how to come to a differential, we will see cases. Here we have history of TB 2 years back to this patient, not completed antitubercular treatment course. Now comes with fever since 2 weeks, cough with sputum since 2 weeks. Here we can see this patchy areas of abnormal opacities on chest x-ray PA view. Some nodules can be seen and let's describe them. So there are multiple variable sized nodules in right upper zone, left upper and mid and lower zones, showing well defined irregular margins. No calcification visible on chest x-ray. So according to history and recent findings on chest x-ray, look at hilum is normal, no pleural effusion. So reactivation of TB will be first differential diagnosis in this case. So further suggest a CB-NAT correlation and go for HRCT or NCCT chest. Moving to the next case, this is a patient complains of cough with sputum since 2 weeks, fever with since 2 weeks, so that's infective. CBC, that is complete blood count, shows neutrophilia, again shows infective, no past history of TB. We can see two nodules here in right lower zone. So it's nodule or a mass. First measure it. It was 2.1 centimeter largest diameter. So it's a nodule. So there are two well defined irregular round nodules in right lower zone with no obvious calcification visualized on chest x-ray, normal hilum, no pleural effusion. So differential will be infective etiology, that is tubercular or pyogenic. This was a 69-year-old male with smoking history, so keep neoplastic as a second differential diagnosis and go for further NCCT chest to rule out whether it has a spiculated margin or not. Like, share and subscribe Radiology Doodles on YouTube and Instagram, and please share our videos. Thank you.